Hi everyone, my name is Joe Munzer. I'm the Principal Investigator and Study Group Chair of the SVI trial. This is a brief video recapping how I approach the consent process for the SVI trial, and I'm hopeful that this video will help you in the process of obtaining consent from potential SVI study participants. So after I've gotten the clinical consent, I typically explain to patients that one of the reasons that we get so many referrals for ERCP is that we're always doing clinical research to figure out better and safer ways of doing the procedure. And that we did a study a few years ago that showed that indomethacin, which is a non-steroidal anti-inflammatory drug, just like ibuprofen or Aleve, really reduces the risk of pancreatitis after ERCP. And I typically take that opportunity to pause and find out whether they have any contraindications to the medication. So are they allergic, do they have renal failure, etc. And once I've established that there are no contraindications or exclusion criteria, then I explain to them that on the basis of our study and many others, people all over the world now are receiving indomethacin to prevent pancreatitis after ERCP. Then I say that before indomethacin, our only option for reducing risk in patients at high risk for pancreatitis was to place what's called a prophylactic pancreatic stent, which is a little plastic stent or a straw that we place in the pancreas at the time of the procedure. It allows the pancreas to drain better, reduces pressure within the tube that drains the pancreas, thereby reducing the risk of pancreatitis, and it's supposed to fall out on its own within a few days after the ERCP. And I explained that on the basis of clinical trials, prophylactic stents are believed to reduce the risk of pancreatitis, and that for a long time in patients at high risk, what has been the standard of practice is the combination of indomethacin plus prophylactic stent. But then I explained that relatively recently, a few studies have come out to suggest that if you get indomethacin, you may not need the stent at all, and that there are some conceptual advantages to avoiding the stent. For example, the very process of placing the stent in some patients may contribute to injuring the pancreas, and that the stent doesn't always fall out on its own. So every single patient needs an X-ray to make sure that the stent has spontaneously passed, and in about 10 or 15% of patients in whom the stent doesn't pass, they need another procedure to remove the stent. So there are some theoretical disadvantages to the stent. But then I go on to say that on the basis of available evidence, many experts believe that the combination of indomethacin and stent is the best approach to preventing pancreatitis. But other experts say that, well, if you get the medication, you may not need the stent at all. So it's quite controversial. And I explain that whenever there's controversy, our goal is to do high-quality research to figure out what the best approach is for patients. And so on that basis, we're in the middle of the SVI trial, which is a large-scale study across the United States funded by the National Institutes of Health, the NIH, that is hoping to answer that very question. So I explained that patients who are kind enough to participate in the SVI trial have a 50-50 chance of getting the medication alone, the indomethacin alone, or the indomethacin plus the stent. Either way they get the indomethacin, the question is, does the stent add anything above and beyond the medication? And then we follow the two groups to see which of them gets more or less pancreatitis and other events related to the ERCP. I explained that there's no additional commitment on their part for being in the study, so they don't need to come back for any visits or anything along those lines, but we will call them in about 3 to 5 days to make sure they're doing okay, and then another brief phone call in about a month to make sure they haven't been hospitalized. I go on to explain that we obviously really appreciate it when people participate in clinical research because the findings could have significant implications in the care of many generations of patients in the future. But I explain that they don't have to feel compelled to be part of the study because either way we'll take really great care of them. And then hopefully they have consented to be part of the study after this conversation, and then I'll ask one of the coordinators to formally obtain the signature and answer any additional specific questions they may have. So hopefully this recap will be helpful to you in the process of obtaining consent, and thank you as always for your ongoing support and efforts in the SVI trial.